Dr. Suleiman, since last week when we spoke to you, you've been hard at work distributing food parcels to health workers in KZN affected by the looting there. Can you give us an idea of the reach, the scope of that work?
Good morning, Anli. That was one aspect of it. In the initial phases, when the hospitals called us and said they have healthcare workers, but they have limited healthcare workers. For example, they said there's like 2 nurses per ward. They couldn't come through because of the violence and the looting. The roads were closed. They were scared to come through. And then there was no fuel. And then eventually when stock started becoming available in the shops, they said, look, how are we going to send them there? It means they're going to wait in queues while there's nobody in the hospital. Who's going to look after the patients? So we implemented a program immediately to take care of frontline workers first. Paramedics from different emergency services, healthcare workers, including doctors and nurses, and even porters and cleaners in the hospitals to make sure that everybody does not wait in the queue, but is available to be on site in the hospitals. So we did another one yesterday at another hospital where more requests came into another hospital. In addition to that, we got calls from hospitals to say that besides the healthcare workers, we don't want to put them in a queue. We have patients who got no food, and we can't access food, we can't buy food. And this is coming both from private and public hospitals, so we made food available to patients. So that's in terms of the healthcare, but it's extended way beyond that. In the last 48 hours, I've received about 5,000 SMSs on my phone alone. And our call lines, they can't cope. There's a call every 5 seconds. And the reality is, besides the looting aspect, there's a lot of hunger in the province. And that hunger is related either to COVID, or to unemployment, or to lockdown, or whatever, or job losses. And we've taken a decision that we're going to help irrespective whether the people are affected by the looting or not. As long as there's hunger, and as long as we can go, we will assist with hunger throughout the province. And right now, we have a request, within 4 days, of 25,000 people needing food parcels.
That's incredible. And in addition to the food, you're also looking to provide healthcare facilities with medication. We know that 2 large distribution warehouses were looted. A lot of medication was damaged there. A lot of pharmacies were looted. Tell us about your efforts to try and source medication from elsewhere and to redistribute that to the areas where it's needed most.
Well, 70 pharmacies have been destroyed. 1 pharmacy came back from one of the towns and said, look, we're the only health facility. There's no hospital, no clinic, no other source of supply in this area. We're the only ones. And if we don't have medication, the entire area has no medication. So that's a private facility, which we told them to come back to us with a proposal. We want to help you. So far, 1 hospital has come back. The other hospitals we've contacted, they're still seeing, they're checking what their stocks are. We've informed the Department of Health to people to see if any hospital requires assistance, please let us know. 1 hospital came back to us and said, look, a lot of optometrist practices have been affected, and they want ophthalmology chairs. So we've already purchased that, and they also wanted syringes for vaccines. They said we can't, it's not available. There's a shortage now because of the disturbance. Can we get that? So we arranged that, and we're waiting. Other hospitals said they'll get back to us to tell us what they require. In addition to the medical facility, we've also asked businesses, small businesses, to see what their requirements are as far as possible, and if it's feasible. We want to have, we're speaking to the corporates, we're speaking to big companies to say, we need to rehabilitate business. Because even though you may give them a food parcel for 1 month, what happens thereafter? We need to get businesses back, they need to become self-sufficient, and each one can create jobs. Fortunately, we've had meetings with quite a few business communities, and they've come back and they said, look, we've lost millions of rands in stock, but it's fine. We'll manage, we'll survive, we'll go ahead, we'll open up, we'll employ people, help somebody else. And that's been a phenomenal spirit, in the province itself, where if people can manage on their own, they say, it's fine, don't worry, we'll manage, help somebody else.
You're very much reliant on donations from businesses and from corporates. We know ordinary South Africans contribute as well, but it's very difficult to put together aid packages based on, a few cans of soup or cans of tinned goods from one household, a couple of packages of dry goods from another household. So corporates and large businesses are the main source of your donations, I believe. Has that been difficult in terms of the fact that businesses themselves are the ones that have been hit in KZN?
No, Anli, this country is an incredible country. I told you, people said, we've lost millions of rands of stock, don't worry about us, help somebody else. Corporates have come to us. Let's take Messmart. Messmart has suffered severe damages, what is companies, its stores in KZN. They've made arrangements to get funding from Walmart in the US. They've arranged truckloads of food for us. They've arranged food parcels for the employees also. Other stores like Checkers have also give special paid leave to the staff that they can't function. So companies themselves that have been hit in a major way are taking care of the employees. And that's another thing we've told companies, that why don't you fund food parcels for your employees? It takes care of them for a month at least. They don't go to the shop. They don't wait in queues. So that space in the shop is created for somebody else who haven't received anything, and they can go and buy, while the shops are taking a few weeks to stock themselves up, and they don't have to wait in the queue. So a lot of companies who have been affected are now funding food parcels for their employees. They're supporting us with goods to help, the general people affected. And in addition, the funding has been phenomenal from the same companies that have been affected and from South Africans in general. Let's take another example. I met the Swedish ambassador on Thursday. He flew to Durban, and he said, we have a very good long-standing relationship with South Africa. We're not going anywhere. We're here to help. We're here to stay. We're here to rebuild. They set up a thing called Team Sweden, which all Swedish companies are affiliated to. On Tuesday morning, they had a meeting with 28 companies. On Wednesday, another 27. On Wednesday, another 21 joined. 48 Swedish companies have pledged their support through Gift of the Givers to help rebuild the province. And like that, we've got interest from Canada, USA, UK, Ireland, Australia, New Zealand, UAE, Belgium, Netherlands. There's been phenomenal interest. People as individuals, as South Africans, outside the country, and companies want to do something to help our country.
It's always so great to speak to us, to speak to you, because you bring us such good news. But we're going to let you get back to the amazing work that you do. Thank you very much, Dr. Imtiaz Suleiman from Gift of the Givers, continuing with their relief efforts in KZN.